Hi, Tracy. Thank you so much for joining us today on the Ride for Warriors YouTube channel. Tracy is a person I met on Instagram who a lot of people I meet are on Instagram, which is really nice. It's great to see that the community is so engaged. I don't want to say any more, so Tracy, why don't you introduce yourself and then tell us a little bit about how you first were diagnosed with CRPS, or I guess when it happened, rather than the diagnosis, because it's not necessarily at the same time. So.
Right. Well, first of all, thanks for having me. I appreciate it. And, having the ability to reach more people is a blessing when it comes to advocacy. My name's Tracy, and I was actually diagnosed with type 2 CRPS following a surgery. For myself, I sprained an ankle in the garage, which I think a lot of people do. And it just wasn't getting better. We were just having some issues with it. I was referred to a podiatrist. And, after being in a cam boot and a lot of physical therapy, it just still wasn't getting better. So at one point I was told, you have plantar fasciitis and it's going to make it better if we do a surgery to release it. And we thought, you know what, if it's that easy, let's do it. So we did that. And unfortunately, things just didn't get any better. And then as time went on, I was told that, after an MRI and additional x-rays, that I had an extra bone in my foot called an accessory navicular. So all it means is an extra bone in your foot. One of the questions in my head was the fact that I'd lived with it for my entire life and it was never a problem till now. So why is this the issue? But after talking to a couple of friends and colleagues, even went back to my primary care, she said, you know what, it should be an easy surgery. And if that's going to help fix the issue, then let's do it. So we went ahead and went into that surgery. And unfortunately, that's where things went awry. We had an incision that was made in the wrong place. Unfortunately, they cut into the tibial nerves, nicked lateral plantar nerve, and other things went awry in that surgery. And when I woke up in the PACU and the post-anesthesia care unit, I knew that something was wrong. It was the worst pain I had ever felt in my life. And so I knew that there was something that was terribly wrong. And that's essentially what started my step into the CRPS world. I was very fortunate that I had a neurologist that was very well versed in a lot of different things, including CRPS. And so I saw her within a few weeks of the surgery. And one of the words that came out of her mouth was CRPS. And she goes, I think you might be dealing with CRPS, but don't look it up. Don't do anything with it. Hold on and let's see if this is just a really bad reaction post-surgically. So, long story short, within a couple of months, we realized it wasn't getting better. The surgery site was healing. There were a lot of complications. And so I was finally sent to a pain management doctor that she recommended, my neurologist. And that allowed me to get a quick diagnosis. Most people, that's just not the case. They're seeing 20 doctors. I've heard some individuals saying they've seen 100 doctors before a diagnosis. So with myself, I was lucky. It still took me 7 years to get into remission, but the reality is getting a quick diagnosis, I felt like it gave me a step ahead of some of the other people that are dealing with CRPS.
Yeah, and for a lot of people, one of the main points of raising awareness through these interviews and the social media campaigns is that it's said that within 6 months, if you can get a diagnosis within 6 months, it's much more controllable as far as pain management goes. And that 6-month cutoff from there on makes it just infinitely harder. So absolutely.
Well, I'll agree and disagree with that. So I think we've all seen the write-up saying 6 months.
Right.
And, my concern with that being out there is, where did that come from? I mean, seriously, I have tried to research that particular statement because I was told the same thing. When I was originally diagnosed, my pain management doctor said, good news and bad news, Tracy. Good news is we caught it early. Bad news is you have CRPS. And he said the same thing to me. You know, if we can catch it within the first 6 months, you have a greater ability to get into remission. And I think you probably do have a greater ability, but my concern is there's a lot of people that have taken that statement and basically said, if you don't get diagnosed in the first 6 months, your chance of remission is none. And I don't agree with that. I lived with type 2 CRPS with a known injury to the nerves, and I was able to get into long-term remission. And I've seen a lot of other people do the same thing. So that's just one of those statements that I'm really cautious with, because I've heard it over and over again, and I can't find the science, the research, or even a physician to back it up.
Yeah. Well, I'm glad I brought it up then, because I've also just been kind of using it as a blanket statement. I never thought of it as a like a 1 or 0 when it comes to coding. Like either you get it, you figure out before, or it's like a hard stop versus later getting into remission as well. But I can
think
understand where
the
that.
problem is a lot of patients hear that
Mm-hmm.
and they think, I didn't get diagnosed until 2 years in, so I'm never going to
Right.
have a chance to gain remission. And I think that's one of my big sticking points is I want everybody out there to know that there is hope and there is help. You know, I think that's the big thing that drives people forward, is knowing that, you know, there's a possibility to regain your life.
Yeah, absolutely. And so a lot of people might not know what the difference between CRPS 1 and CRPS 2 is. Would you be willing, or type 1 and type 2, would you be willing to explain that
Absolutely.
to everybody?
Right. So type 1 is where there's an unknown etiology, meaning somebody got a snowboarding accident. They were playing soccer and they have a sprained ankle, a sprained wrist. I've had other people that I've spoken with and treated that they were playing hockey, ice hockey, and they took a hard check into the boards. They didn't break anything, but yet they ended up with CRPS. So if there's no damage, known damage to a nerve, then they're going to say it's CRPS type 1. CRPS type 2 is where we know for a fact that there's injury to a nerve and there's involvement with a particular nerve. So with myself, from the op reports and other surgeries that I had to go through to correct it, the mistakes that were made, we knew for a fact that they cut into some of the nerves, the tibial nerves, and actually nicked some other nerves. So when you know that there's known damage to a nerve, then they're going to consider it CRPS type 2.
Okay. Well, thank you for explaining
You're
that. 'Cause,
welcome.
it's always I'll have an interview and then someone watches it and will be like, wait a second, what are you guys even talking about? So I try to make
Right.
sure I'm as cognizant as possible for the audience. And so you get your diagnosis, and then and it's in your foot, correct?
It started in my left foot and ankle, and that's where the incision was made. That's where the surgery was. What they call the medial, or the inside of the ankle, is where the incision was. And I ended up having to go through 2 reconstructive surgeries, and that was with CRPS. And, you know, we just took precautions, meaning we ran ketamine during the surgeries. They did additional blocks. Yes, everybody's going to say, you know, it's not wise to have a surgery once you've had CRPS, but the problem is life goes on. And for myself, if I would not have had the 2 reconstructive surgeries, I wouldn't be walking right now. That's how much damage was done. So sometimes it is necessary, and if that's the case, then take proper precautions. So for me, it took me 7 years. It started in left foot and ankle. Eventually, it spread up my left leg. It tried to mirror to the right leg. I did just about everything that any other patient would do. I did local blocks, regional blocks, lumbar sympathetic blocks because it was lower extremity. When I wasn't getting any relief out of the lumbar sympathetic, as a matter of fact, after 13 blocks, I ended up going into adrenal failure because of the blocks, because there was too much cortisone in my body. So we had to address that. And then following that, and during this whole time, there was tons of physical therapy going on. You name it, I did it. At one point, we found a protocol that said hyperbaric would get CRPS into remission. so I talked to my pain management doctor. He was a great person to play along with me, because every point and every appointment that I had with him was always me bringing in information. Why can't we do this? Why can't we do this? They're doing this here, they're doing this there. So I was always looking, searching, trying to find a way, because I couldn't accept the fact that I was told at one point, life as you know will end. And that hit me pretty hard. I'm like, what does that mean? You know, I'm not dying, although there were days that I wanted to. But the reality was, I felt that there had to be a way of moving forward to be able to get to a functionable level and get my life back. And I wasn't going to stop until I did. So I did close to 30 rounds of hyperbaric. Unfortunately for me personally, it didn't help. And then eventually I was told that let's look at a spinal cord stimulator. I don't know, everything in my gut told me don't do it for me personally, but they finally said, you know what, do a trial. Let's do a trial. Let's check it out. Let's see what would happen. So I did a trial and it went really well. For me, I was able to do a lot with the trial that I wasn't able to do without it. So we did move forward with a spinal cord stimulator. And I asked all the appropriate questions. Do I need to worry about the CRPS spreading? Do I need to worry about the additional surgery? Do we need to run ketamine? Are there any precautions we need to take? And I kept getting told that no, that never happens. It never spreads because of a spinal cord stimulator. And unfortunately for me, it did spread. I went through 2 spinal cord stimulators. The first one was with a paddle. We'll leave the company name out. And I had a lot of issues with it. The first one that I did was a rechargeable battery. And every time I'd recharge the battery, the initial area of my left foot and ankle would get about 3 to 4 times its normal size from swelling. And they didn't want to believe me. So we started taking videos and pictures and sending it in to the reps and sending it in to our doctors. And they finally said, wow, there's a problem here. Yeah, there's a problem. So we took out the rechargeable battery, put in a non-rechargeable, hoping that would help. And unfortunately, the system started going haywire, meaning even if I had it on a very low intensity, it all of a sudden out of nowhere would send a really high intensity to the point that I couldn't feel my leg or my foot. And there were several times I actually fell down the stairs because of that. And yeah, I was finally told, you know what, let's take this out. We don't know why it's malfunctioning. They put in a different type, a different brand, and had the same issues with that particular one. And within 6 months, had a buildup of scar tissue on the dura, and essentially was told that if we didn't take out the spinal cord stimulator, in addition to CRPS, I could be paralyzed.
Oh my gosh.
So at this point, I have CRPS all the way up to my shoulders. It started in a foot and ankle, and it had spread all the way up to my shoulders because of the placement, the surgical placement of the spinal cord stimulator. And I had scar tissue on the dura of the spine. So needless to say, that spinal cord stimulator got taken out immediately. And when it got taken out, unfortunately, I was told by my pain management doctor, a neurosurgeon, and my neurologist that they didn't know what else to do. Their attitude is, we'll try and keep you as comfortable as possible, but that was our last option. And I couldn't accept that. You know, at that point, I was maxed out on opiates. If it would have been today, most people couldn't even get the amount of opiates that I was on, because at one point, I was on Dilaudid, methadone, oral ketamine, Solandac, Valium, and the list went on and on and on. And that was all at one time. And the problem is even with that amount of medication, my pain level averaged between an 8 and a 10 out of 10. So it wasn't working, you know,
absolutely.
And that's, I think, what a lot of people run into is, what do we do when blocks don't work and physical therapy don't work and occupational therapy and you know, hyperbaric and spinal cord stimulators? Some people do get relief. I know I saw one of your other interviews you did with a young lady, and she was getting some relief out of it. And I'm glad to hear that.
Yeah, another interview with Andrew, who also had a spinal cord stimulator, and while it hasn't given him full relief, it has definitely helped. So yeah, I mean, it does help for some people, but CRPS is tricky that way, where one thing can help one person, but not everybody. There's no like.
That is exactly it. And that's what I tell people all the time, whether I'm talking with them on the phone or even when I'm doing talks at medical conferences or with support groups, is we're all as individualized as our fingerprint. So the reality is we need treatment options that can be individualized to us. A cookie cutter doesn't work. I mean, it's great for some things, but in reality, we're all individuals and we need to find those things that are going to meet our specific needs, because there's common threads with all CRPS. But the bottom line is there are also a lot of differences because we're all unique.
Right. Yeah, well, thank you so much for sharing your story, Traci. We have quite a bit more to talk about, and I'm excited to do that with you and hear how you got into remission, and then hear a little bit about your book as well, because I know you documented your journey via your book. And we'll do that, or you will see this next week on our next video. So thank you, Traci, and stay tuned, guys.